Half a day and welcome. My name is Audrey, and I have the pleasure of being your moderator today. Thank you for joining us as we kick off Guam Behavioral Health and Wellness Center's first ever prevention web series, The Lunch Hour with Peace. We invite you to join us on the third Wednesday every month to talk about mental health and substance use prevention. Learn from our guest speakers, hear about valuable resources in our community, and connect with us at Peace. To learn more about our branch and the upcoming episodes in our series, visit peaceguam.org and press subscribe on the top right of the homepage. Today's topic is on vaping and the COVID-19 pandemic. The economy, our healthcare systems, and our daily lives are changed in the past year by the global pandemic caused by COVID-19. Its impact is seen and felt by everyone in our island community. Still on the wayside, identified by the American Medical Association as a public health epidemic, is the use of e-cigarettes and vaping. The 2019 declaration was influenced by the skyrocketing rate of teen vaping and an outbreak of vaping-related illnesses throughout the US. In today's presentation, Dr. Annette David will bring to light the intersection of these two public health crises and what we can do as an island community to eliminate their compounded impact to our people's health. So before we get started, here are some reminders. First, this webinar is being recorded. The recording can be accessed on peaceguam.org and on Facebook through @GBHWC. Second, all participants are muted throughout the session. Feel free to use the chat box to say hi and connect with other attendees. Third, all questions directed to our speaker or any of the Peace staff must be submitted using the Q&A section located at the bottom of your screen. After the presentation, we will have some time to answer any questions related to the topic. Sarah and other Peace staff will be monitoring Q&A submissions to ensure we respond to your questions during or after the webinar. Finally, some concepts discussed in today's topic may trigger discomfort or negative feelings from past traumatic experiences. You are not alone. If you are looking for one-on-one support, we have staff on standby that you can message privately via the chat box. Look for the user Keep Me Safe. Messages to that user will be monitored by Michelle and Christiana. If you are not comfortable reaching out to our staff, the Guam Behavioral Crisis Hotline at 647-8833/4 is also available. Now let's get started. I'm excited to introduce our guest speaker. Dr. Annette David is an internist and occupational and environmental medicine specialist who completed her Doctor of Medicine at the University of the Philippines College of Medicine, Master's in Public Health at Columbia University, internal medicine residency training at the State University of New York at Stony Brook, and postgraduate fellowship at Yale University. Dr. David was technical officer and eventually regional advisor for the Tobacco-Free Initiative at the WHO Western Pacific Regional Office before moving to the U.S. territory of Guam. She serves as the Guam Department of Public Health's tobacco control consultant and chairs the State Epidemiological Outcomes Work Group of Guam. She is adjunct faculty at the University of Guam's Cancer Research Center, the University of Hawaii Cancer Research Center, and also guest faculty for the Johns Hopkins School of Public Health's Institute for Global Tobacco Control. Dr. David sits on the board of the American Cancer Society Hawaii Pacific and is a board member of the Guam Board of Medical Examiners. She is founding member of the Guam NCD Consortium, the Guam Comprehensive Cancer Control Coalition, and the Guam Tobacco Control Action Team, which was a 2019 WNTD awardee for the WHO Western Pacific region. She is founder and senior partner at Health Partners in Guam. She is also the recipient of numerous national and global awards, including the 10 Outstanding Young Men of the Philippines National Award for Environmental Medicine, the 100 Most Influential Filipino Women Award for Global Health, the Guam's Governor Award for Outstanding Service in the Medical Field, Certificate of Special Congressional Recognition for Outstanding Service in the Medical Field, Certificate of Recognition by the 32nd Guam Legislature for Outstanding Service and Commitment to the Community of Guam in the Medical Field, and the UP Alumni Association of America Distinguished Alumni Award for Global Health and Community Service in 2015 and 16. Dr. David, it's an honor to have you as our first guest for the Lunch Hour with Peace. Thank you for accepting our invitation.
Thank you, Audrey, and good afternoon, everyone. Buenas yan half a day. Give me 30 seconds to share my screen with you, and we can get started. All right. So today we get to talk about two epidemics that have come head to head, the vaping epidemic and the COVID-19 epidemic. Before going into the presentation, I did want to make a couple of disclosures. The first is that I have no known conflicts of interest to declare. And secondly, and very importantly, this presentation reflects the collective work of the Guam Behavioral Health and Wellness Center Prevention and Training Branch and the members of the State Epidemiological Outcomes Work Group in Guam, which I've been very fortunate to share over a decade and a half now. And then finally, the evidence regarding SARS-CoV-2, which is the virus that causes COVID-19, and the use of electronic smoking devices continues to evolve. And information may change as more is discovered about the virus and or about vaping. So the information may shift and change over time. Just a quick word about Guam's SEOW. This is a data work group that was established by the Guam Behavioral Health and Wellness Center and is the longest running data group in Guam. It was born in 2003 when Guam received the Strategic Prevention Framework State Incentive Grant, and the SO started operations in 2004, establishing its data inventory by 2005. It published its first epidemiologic profile consisting of data on tobacco, alcohol, and other drug use in Guam in 2006 and has been publishing these profiles on a biannual basis since then. And then in 2008, the focus on life suicide prevention grant was added to its scope of work. And the suicide profile, the first one, was published in 2009. And when the grant ended in 2011, the data was very important, and so it was incorporated into the EPI profile. And we have just released the 8th edition of the Guam Epidemiological Profile this year with the Guam Behavioral Health and Wellness Center. And it contains information on the, tobacco, alcohol, other drugs, as well as mental health and suicide. So a couple of, three learning objectives that we have for today over the next 25 minutes. One is to deconstruct the misconceptions about vaping, and then delineate the potential and perceived risks of vaping during COVID-19, and talk about what effective strategies we can implement to stay safe during this pandemic. So when I first gave a similar talk on this topic back in April, there were only 3 million global cases of COVID-19. As of yesterday, the 20th of October 2020, there were over 40 million cases globally and over 1 million people who have died from this virus. 189 countries have been affected. It's gotten to a point where the very head of the World Health Organization said that we have never before seen a pandemic of this magnitude. You know, it's a strange time, and we've never really seen a global crisis like this. This virus has really brought the world to a standstill. And if you think about it, what has effectively paralyzed us as an island community and as a global community is not anything that we could have predicted. It's not war, it's not nuclear arms, and it's not climate change. Instead, it's an invisible enemy, a virus which is not even considered fully alive. And I'll say that again, a virus is not considered to be fully alive. It requires a host to survive and to propagate. Now, this pandemic of COVID-19 is caused by a virus that belongs to a large family of viruses known as coronaviruses. And the reason it's called a coronavirus is because it's got these little protein spikes all around it that make it look like it's wearing a crown or corona. So these Viruses are very primitive organisms, and they're really just genetic material covered by a protein coat. These protein spikes on its surface are actually very essential for its survival because they're the ones that combine with receptors in human cells along your nasal passages and respiratory tract. And when these protein spikes combine with this receptor, which is called the ACE2 receptor, the protein spikes unlock that gate. And this enables the virus to enter the human body. When this happens, then infection is established. And so these protein spikes are critical, and the receptor on your cells are also critical. And we'll get back to this because this is, in fact, one of the mechanisms that vaping contributes to increased transmission of the virus. So it's important to emphasize that majority of people with cases of COVID-19 have mild or no symptoms. As much as 81% of people may not know they have the infection, but they are capable of transmitting to others. About 14% have severe symptoms that require hospitalization, and another 5% have it so bad that they need to be in the ICU. But it's important to remember these five things. This is a completely new virus. It's never been around humans before, and therefore, no one has any previous immunity, which means we are all susceptible. Secondly, while majority of the cases have mild or no symptoms, they are all infectious. And severe and critical cases will need extensive medical care, which means that our health system must be ready to absorb the increased demand. And very importantly, healthcare workers need to be protected and prepared. So, who's at high risk for COVID 19? Not everyone is at high risk. So, it's important to know who is most vulnerable so that they can take more steps to protect themselves. And we know from China that the elderly, for example, may have as much as a 7 times higher risk of dying than those who are younger. Anyone immunocompromised, whether because of immunotherapy like long-term steroid therapy or cancer therapy, or because of diseases that reduce your immune system's ability to fight off infections like HIV, AIDS, or cancer. There are comorbidities that also increase your risk, including hypertension, diabetes, kidney disease, coronary heart disease, and obesity also plays a big role. And I'll show you a little bit about that later. And finally, very interestingly, from China and from Europe, it was determined that smokers have anywhere from 1.4 to as much as 2 to 3 times the risk of non-smokers of requiring hospitalization and potentially of dying from COVID-19. And the question is, where does vaping come into play? Is the risk like that of smoking? So this shows you some data from the US CDC that demonstrates how older age can really increase your risk. And you'll notice that the factors that increase community spread include crowding, close physical contact, and close spaces, and long durations of exposure, but also some of the disease conditions that put you at higher risk for severe COVID, including hypertension. And you'll notice here obesity and severe obesity can actually increase your risk significantly. And the more of these conditions you have, the higher your risk. So a little bit about how COVID-19 is transmitted. I think what we have to remember is mostly the virus mixes in with your respiratory secretions like mucus, like nasal secretions, or even saliva. And then is expelled during the act of breathing, speaking, coughing, or sneezing. And because the virus is mixed in with respiratory secretions, we call them droplets. Now, droplets have weight and they have mass. So while they are expelled into the air, over time, gravity will pull them down. and they will fall to the ground or to a surface. Depending on how forcefully they are expelled, the distance at the point where they drop to the ground will differ. So if it's just from talking, you'll notice that after about 1.5 meters, which is like 3 to 4 feet, they'll drop to the ground. But if the force of expelling them is stronger, such as when you cough or you sneeze, the distance will be greater. By the time the droplet with the virus falls to the ground, it can be anywhere from 2 to 6 meters. Now, the 2 meters, that's about the 6 feet distance, which is where we have this number of stay at least 6 feet apart from the next person. So one way you can get the infection is that you breathe in the air. If you're close to someone who's infected and you breathe in the air that they exhale, or the air that is there when they laugh or they sneeze or they cough. And if you do that, then the virus enters into your respiratory tract and infects you directly. There's another way you can get infected, and that is if the virus in the droplets falls to a surface like a cell phone or a computer or a desk, and it can stay there, it can survive there for some time. And now you, the uninfected person, touches this surface. Now, the virus can't go through intact skin, so that's not how it's going to enter your body. But if your hand, which now has the virus on it, you use that hand to rub your eyes, to rub your nose, or you put it in your mouth, you expose your mucous surfaces to the virus. So the hand to mouth pathway is another pathway for you to get infected. Can the viruses just float freely in the air? That's what you call an aerosol. And the answer to that is yes. Normally, this happens during medical procedures like certain forms of ventilation or nebulization, which is why in the healthcare setting, the layers of protection that healthcare workers have to use are much more intense and stronger or more powerful than the sorts of protections we use in the community. But these are how the viruses can get transmitted from one person to the other. And it's important to remember that the virus can survive on surfaces for a significant amount of time. So for instance, on coins like your pennies, which are made of copper, the virus can survive on that surface for about 4 hours. On paper or cardboard, it can survive for up to 24 hours. On plastic and stainless steel, it can survive for 2 to 3 days. Free virus in the air lasts only about 3 hours. So you notice that when the virus in a droplet is on a surface, it can actually survive longer, which is why hand hygiene is very critical and sanitation of surfaces is also important. So how do we prevent infection? In the healthcare setting, the healthcare workers have to use standardized types of respirators, either the N95, which is what we would call in occupational medicine a negative pressure respirator, or they can use positive airway pressure respirators. But not all of us can use that. So in the community, what we have found and what the data are confirming is that cloth masks made of tightly woven fabric, worn properly and worn at all times, can protect us from the virus. For the person who's infected, you want them to wear the mask so that the mask can catch the droplets that they would otherwise just expel into the air. For the uninfected person, you want to wear the mask so that, in a sense, you are protected from breathing in those droplets with the virus. And also, the mask helps to prevent you from touching your nose and your mouth. Hand hygiene is very important because you don't want to transfer the virus from an infected surface using your hands to your mucous membranes. And distance is very critical. And here we are using the average distance of about 6 feet, which is about 2 meters, and about the distance where normal exhalation will bring the droplets to the ground. Very importantly, all of these measures, wearing a mask, physical distancing, and hand hygiene, have to be done within a system where you are actively trying to find cases and isolate them. So contact tracing, testing, widespread testing, and isolation of all patients is also very important. I think it's important for me also to emphasize that there's no one measure that will work. We need to have all of these measures in conjunction, working together to protect ourselves and our families. So that's a little bit about COVID-19. Let's now go to vaping. So what is vaping? And you'll notice here that I have used quotation marks around the word vaping. And I do that because our perception of an issue influences how we deal with it. And this idea that an electronic cigarette produces vapor, meaning water vapor, was intentionally created by the industry that promotes these devices to make us think it is safe. It's really important because most people, even healthcare workers, have bought into this subliminal advertising and promotion, and they're unaware that, in fact, they're being manipulated by marketing tactics of the vaping industry. So we really need to deconstruct this vaping in quotation marks behavior and really look at two central misconceptions. One, that vaping, unlike smoking, is safe. This is a myth, this is a misconception. And a lot of this is being promoted by the industry, wanting us to think that what you're inhaling is just vapor, when in fact, it's an aerosol. The second myth that we want to deconstruct is that vaping is there to help smokers quit their addiction. And this comes out of the science of harm reduction. And we'll see how flawed research was used for this, and industry has been influencing science. So just very quickly, there are several types of alternative tobacco products, right? There are electronic nicotine delivery systems. These are devices that make use of liquids that contain nicotine, and they heat them to a point where the liquid turns into a gaseous aerosol. These are sometimes called ENDS. There is a type of device that makes use of non-nicotine liquids, and these are called ENNDS. And then you have heated tobacco products, which make use of tobacco. So these products use leaf tobacco and heat the tobacco, but not to the point of combustion. They only heat it to a point where a gas is released. And this is found in products like IQOS, which are very popular right now in Japan. So when you think about an electronic cigarette, this has actually evolved over time. And we now have 4 generations of the device. The first generation really just looked like a disposable cigarette. The second generation made use of pre-filled or refillable cartridges. The third generation had tanks, or what they call mods. These are refillable, and you can make your own custom electronic cigarette liquid. And finally, the fourth generation are the ones that look like thumb drives, or in some cases, they look like inhalers, like the Swaran pod, and they can be pre-filled or refillable. Now, some of the companies will say these are very safe because they don't contain nicotine in the liquid. And in fact, the data says that you can't really rely on what the companies say. Why do I say that? In 2015, in the UK, they looked at 50 e-liquids that said that they were nicotine free, and they found that in 46 of the 50, nicotine in excess of what was labeled was in fact determined. In 2018, in the USA, they looked at 35 samples that claimed to be nicotine free, and in fact, they found nicotine in over 90% of those samples. And finally, in Australia, just last year, nicotine was detected in 6 out of 10 nicotine-free liquids, and there were a number of known chemicals and several unknown chemicals that were found in the liquids that were toxic to humans. Now, One pack of cigarettes contains a certain amount of nicotine, right? Can you tell me how much nicotine do you find in one pod of the Juul device? The Juul is a fourth generation type of e-cigarette. And one pod, can you guess? One pod has the equivalent nicotine as one pack of cigarettes. Now the fixed pod, one pod of that has the equivalent of two packs of cigarettes. And the sworn, which looks like the inhaler, one pod of that, that's heavy duty, that's got the equivalent of three packs of cigarettes. And so this raises the question, if the vaping industry really designed these products to help smokers quit smoking, and we know that nicotine is the substance that keeps smokers addicted, why is the nicotine level so much higher in these devices? So I think we really just have to think about that and also realize that because the nicotine levels are quite high in these pods, that the risk of addiction is in fact even higher with the use of e-cigarettes as compared to smoking. Now, the first myth says vaping is safe because it's just water vapor, right? Is that in fact true? So let me show you this table, which has some 40 chemicals that we know are found in cigarette chemicals, and I want you to look at them. And can you tell me which four are found in the e-cigarette aerosol? So I want you to pick four out of this list. So let's see which of these are found in the aerosol of an electronic cigarette. In fact, all of them are found in the e-cigarette or the vape pen aerosol. And some of these are known or established as human carcinogens and human toxins. So it's not a vapor and it's not safe. In fact, the evidence is that the use of these devices causes harm. Simply put, electronic cigarettes produce not a vapor, but an aerosol. An aerosol is a mixture of different chemicals suspended in air, suspended in a gas. And the vape aerosol contains many harmful chemicals and toxins, some of which are known to cause cancer, heart disease, and lung disease in humans. Second, we already have a growing number of experiments that use cell cultures, animals, and animal studies that show that e-cigarettes have multiple adverse health effects. And finally, now a growing amount of evidence in humans with case reports or even population epidemiologic data showing how these devices have led to actual health effects. And the most popular actually was happening in the US right before we had the COVID-19 pandemic. You may have heard of an outbreak known as e-valley or e-cigarette or vaping product use associated lung injury, which caused a number of young people to die or require hospitalization because of the use of these products. There's also a lot of collateral damage coming from the devices. If there's such a thing as secondhand smoke that can affect the non-smokers around the smoker, there is also secondhand vape. So electronic cigarettes can affect non-users who are close enough to see or to smell the vape or the aerosol cloud. There is poisoning that is happening with the e-liquids. And in fact, we already have documented cases of suicide attempts that make use of the e-liquid, as well as death in infants and younger children who have mistakenly ingested the e-cigarette liquid because they're very attractive. They have fruit flavors and they smell very nice. And another form of collateral damage is explosion and fire risk, with several of these devices having caused severe burn injuries and fires, including here in Guam. You'll recall that we've had a number of cases in Guam who've required reconstructive facial surgery because the devices exploded while they were being used, and also at least one car that burnt because a person left their electronic cigarette in the car outside in the hot sun. When the device exploded, the car burnt down. So no, these are not safe to use. Uh, is is this device helpful for people who want to quit? And for that, you talk about harm reduction. The idea in harm reduction is that you are going to substitute a device so that the risk is lower. But you know, for when you talk about harm reduction, you really have to ask yourself, what is your baseline harm to begin with? The idea in promoting harm reduction with electronic cigarettes is that when you smoke a cigarette, you're exposed to over 7,000 chemicals. And when you use an electronic cigarette, you only are exposed to 60 to 110 chemicals, right? But the question is, what was your baseline harm to begin with? And so, if you think about it, if you're a cigarette smoker and you quit smoking cigarettes completely and now switch to using an e cigarette, in that case, you have reduced your harm. You've not eliminated your harm, so you're not quite home safe. You still have some harm, but it was less than your baseline. But what if you're a cigarette smoker, you now start using the e cigarettes, but you don't give up your smoking? In this case, you have added on to the harm that you're already exposed to. And if you're a non-user, you've never smoked, but because of the advertising or because your friends are using e-cigarettes, you become attracted to them and you start using them. Well, in this case, you started from a baseline of zero harm and have now added harm to yourself. And we have data that shows that of all the people who use electronic cigarettes, 30% of them were cigarette smokers who have quit smoking and now switched exclusively to e-cigarettes. And for this 30%, they have reduced their harm. They've not eliminated the harm, but they've reduced it. But 59% of e-cigarette users are still smoking cigarettes, so they've added to their harm. And 11% were never smokers who had zero harm to begin with and have now taken on increased risk. So for 70% of people who use these devices, in fact, they have not reduced their harm, they have increased their risk. So at the population level, the net effect is increased harm. We know that the number of vapers is growing globally. We know it is rising very quickly among our young people. Our data in Guam is quite eye-opening because we know in 2017 that about 7% of adults report using these devices, but for our high school youth, it's 26%, 1 and 4, and for our middle school youth who are very young, almost 1/4 report using these devices. That is quite worrisome because these are young people who started out with zero harm. These were never smokers. And now about a quarter of them have taken on an additional health risk. So does vaping help smokers quit? We know that most adult users do not stop smoking cigarettes but end up using both products. And so the net effect is increased harm. There's also been a study in the US that shows that those who tried to quit using ends actually were less successful at quitting than smokers who just stopped cold turkey. And among Italian e-cigarette users, what they found was that the chance of restarting smoking is actually higher in those folks trying to quit using these devices. So we really should not fool ourselves, right? Switching is not quitting. You're just substituting one form of addiction with another. And why is this so popular? Well, it's a big industry, my friends. One of the professors in the UK, he said there's an agenda to portray electronic cigarettes as safe. And that, in fact, is true. This shows you the companies that make the most money out of electronic cigarettes. There's 6 of them. 4 out of the 6 are tobacco companies. Think about that. British American Tobacco, Imperial Tobacco, Japan Tobacco, and Altria, which used to be Philip Morris. And then of the 2 that did not used to be tobacco companies, Philip Morris bought a 35% share in one of them. So today, 5 of the 6 companies that make the most money out of electronic cigarettes are in fact tobacco companies. Do they really want you to quit your addiction? Absolutely not. It's a big business. It used to be, when this started out in 2003, hardly anyone was buying these devices, but today it is a $19 billion industry. There's a lot of money to keep people using these devices. Now we come to the third part. How does vaping impact COVID-19? Because I said at the beginning that what we're seeing is really a coalition of several types of epidemics. So the vaping epidemic impacting the COVID-19 pandemic. We don't have a lot of direct data yet, but there's some early evidence that seems to indicate increased harm from vaping and COVID-19 exposure. So I think let's start by being practical, right? One of the biggest protections we have right now, and I have to emphasize that at this point in time, all we have to fight the COVID-19 virus is to prevent transmission. And one of the biggest ways that we can do that is through the use of a face mask. Well, think about it. For you to smoke or for you to vape, you have to remove your face mask, right? And then if you are smoking or vaping in public, you have to go to a designated smoking area. These areas tend to be small, which means if there are other people there vaping and smoking with you, it will be difficult to physically distance. Third, think about the behavior of vaping and smoking, hand to mouth. And that repeated hand to mouth contact increases your risk of acquiring the COVID-19 infection if the surface you're touching has the virus on it. Some of these devices are even shared among users, especially among our youth. So that sharing can facilitate infection. And I did want to also remind you what is a cigarette made of? It's made of paper. So how long can the virus survive on paper? 24 hours. What's the vape pen? What's the e-cigarette made of? It's made of plastic and metal. How long can the virus survive on that sort of surface? Up to 3 days. So the hand to mouth and the long survival time on these surfaces put you at higher risk. And finally, if you're infected and you're exhaling an aerosol, you're exhaling the virus in that aerosol. And so I tell people, if you can see the aerosol cloud, if you can smell the aerosol cloud, and there's virus in there, you're exposed. So the secondhand aerosol also can propagate COVID-19. What about enhanced infection? All right. So remember I mentioned earlier about how there is a receptor in our respiratory system through which the virus enters, the ACE2 receptor. It turns out nicotine causes more of those receptors to emerge. And so nicotine, in fact, increases the entry points for the virus. And that's very important. We also have data that the use of either cigarettes or electronic cigarettes reduces the immune response of our respiratory system. And so that's important as well. So here we are with nicotine, we increase the number of entry points for the virus. With the cigarette and aerosol smoke, we reduce our ability to fight it off. And we're basically throwing the door wide and letting that virus enter our bodies. We also know now from data in the US that among young people who were tested for the virus that causes COVID-19, those who vaped were 5 to 7 times more likely to be infected. So this sort of confirms that that data that says that your chance of getting infected is higher if you vape or smoke. And also more severe infection. Vaping-associated comorbidities like lung and heart disease are linked to more severe COVID-19 infection. And vaping may, in fact, precipitate the cytokine storm associated with severe COVID-19. And finally, the loss of protection. Young adults who smoked or vaped had double the medical vulnerability to COVID-19 as compared to non-smokers. And widespread vaping among young adults may, in fact, explain why in the US, about 20% of COVID patients with severe disease are young people, when in fact we should be expecting this to happen predominantly in older people. And then there's also prolonged illness and slower recovery among persons aged 18 to 34 with no chronic medical conditions. 1 in 5 had not returned to their usual state of health if they were vapers or smokers. Finally, I think, and very importantly, the industry, the vaping industry, has made use of the COVID-19 pandemic to help promote their sales. And one way they do this is by promoting false research. We've heard of fake news, there's also fake research. Early on in the COVID-19 pandemic, there were news reports going around in social media that in fact smoking and vaping protect you against COVID-19, which is absolutely untrue and not borne out by the data. In addition, a lot of these companies have been using the pandemic to promote their products. So they're using pandemic themed promotions. For example, there is a company in the US that will give you a 19% discount on your electronic cigarette liquid if you type in the promo code COVID-19. So talk about being opportunistic, right? So let's continue selling a dangerous product because it's good business. A lot of these businesses have been lobbying governments, particularly in Asia and in Europe, to consider tobacco and e-cigarette businesses as essential. Well, in fact, they're not essential. They will, in fact, promote and facilitate your getting severe infection. And then also using pandemic relief to promote their corporate social image. The photo on the slide is from Bangladesh. The biggest tobacco industry there is donating oxygen tanks for COVID-19 patients, which is rather ironic. And finally, they make online sales and home delivery in some places in Asia. You can have like a grab and go app that will deliver your e-cigarette to your home. And this really makes it so much easier to get these products. And if the buyers are younger than 18 or 21, they can bypass regulations. So I think a lot of things are happening right now. What is it that we can do? Well, for healthcare workers, definitely, if you have patients that are suspected of having COVID-19, ask them about tobacco use and electronic cigarette use, and ask them about secondhand exposure. I think for all of us, we need to avoid these products. And for healthcare workers, avoid promoting them as a way to quit tobacco smoking. These are not real harm reduction products. And we do need to avoid also being fooled by the industry. Certainly for parents, for teachers, for healthcare workers, advise your students, your children, advise your patients to quit all forms of tobacco use, including electronic cigarettes. There's no better time to quit than now during this pandemic. You don't want to increase your risk of getting COVID-19 by a, even a bit. And this is the best time to quit. And finally, for all of us, we need to advocate really for good policies that can end the use of these products, and also to consider that tobacco cessation and e-cigarette cessation are essential for COVID-19 protection, for COVID-19 health promotion. So just in conclusion, vaping and COVID-19 are a bad combination. Vaping is not safe. Smokers who use these devices to quit their tobacco use are less likely to succeed, and they have also increased their health risks. There's a commercial agenda to perpetuate vaping, and now we are beginning to see mounting evidence that vaping can actually increase your risk for acquiring COVID-19 infection and for having severe, potentially fatal COVID-19 disease. So we do need a comprehensive approach. And what we'll find is that In fact, vaping and tobacco cessation have to be incorporated into our pandemic strategic plan. Ultimately, government and the Department of Public Health can create the policies and guidelines, but I think very importantly, the implementation of all of these steps to reduce our risk for COVID-19 really rely on implementation at the individual level. So we all have a role to play. And it's only in working together in conjunction with the Department of Public Health and with the government and citizens who are fully compliant with science-based interventions to keep us healthy. That is the way that we are going to get over this pandemic. So with that, I'm going to stop my screen share. I do want to thank all of you for the opportunity to share some of our data with you. And I wish everyone safety and good health. And I think Audrey or Sarah will have some questions. So I'm happy to take questions now. Thank you.
Thank you so much, Dr. David. We always learn something new and actionable from your presentations. We have some questions received on the Q&A box, which I will read out aloud. But before doing that, to all of our attendees, we appreciate your questions and comments. We will try our best to go over those today during the webinar. But we have actually a lot more time left that we carved out for questions. So if you have any more questions or comments while Dr. David is answering the first few ones, please do share them on the Q&A box. So the first question, do you know if Guam's death rate for those who test positive for COVID has significantly increased the overall death rate from other causes from prior years?
Oh, that's a really good question. And I think, we will definitely know at the end of the year because as you know, death rates are calculated on an annual basis. But just looking at the absolute numbers of deaths, I think that this is going to contribute to an increase in overall death rate. We know in the country, for the US, already COVID-related deaths are now, I think, the third top cause of mortality overall. And we have seen in the US about a 20% increase in the overall, what we would call the expected death rate at this point in time. So I think you are spot on with your question. And I think that this will turn out to be a major increase in mortality for Guam.
Thank you for answering that. The second one is from Miss Linda Flynn. We might know this person.
Hi, Linda.
Would adding the question, if you vape or use e-cigarettes, how often do you share your devices with friends or family, to the YRBSS be helpful to determine how common the practice is on Guam, and then use this data to determine the need for an education campaign to stop or reduce sharing of devices? I am hearing that shared use is quite common among youth, even during the COVID outbreak. And she says it's an excellent presentation.
Oh, thank you. Linda, we miss you. I have to say that I think we may not even have to wait for the YRBS to ask this question. I would encourage all folks working with young people, with youth, to ask this question. So pediatricians and family doctors who see patients in the middle age and middle school and high school, ask this question every time you see your young patients. School teachers and guidance counselors, ask this question when you have encounters with your students. Parents, you should ask this question as well. I think this has practical implications that will affect how we do medical practice and how we do health promotion on island.
Another familiar name or face behind the comment, Mr. Peter Cruz says the new force of BTI or COVID-19 is ask, avoid, advise, and advocate.
Absolutely. I'm so happy to hear from you, Pete. For the rest of the group, Pete was our first certified brief tobacco cessation counselor for Guam over a decade ago. And so we owe him a lot. And yes, we have to consider the use of these devices now when we do our interventions for cessation, for tobacco cessation. Absolutely. And advocacy is so important because, this pandemic, this is not something that the governor will solve by herself. This is not something that the physicians advisory group will solve by themselves or by public health. This is going to require all of us working in concert to do what we know to prevent transmission so that we can get over the hump and get over this pandemic. That's the only way we'll be able to get a handle on the infection on island, and that's going to be very critical, is that everyone does their part, which we can because we're Guam, right? We're Guam strong. We can do this.
Another question. Does vaping cause the same types of cancer as regular cigarette smoking?
That's another excellent question. And I will say that at this point, the data for vaping is still very young, unlike the data that we have for cigarette smoking, which is very well established. But already we are seeing evidence of genetic abnormalities that are caused by exposure to the vape aerosol, and also animal studies that show tumors, the creation of new tumors when exposed to these chemicals. And so I would say that the likelihood is that vaping will be considered at some point in time a source for the development of cancer. I mean, I think ultimately, think about it. You don't really know what's in that e-liquid because it's not a pharmaceutical substance. It's not regulated. So any maker can put whatever they want in those e-liquids. They don't even have to disclose the chemicals that are in there. So not knowing that, would you willingly take that into your lungs? And that's the question every vapor, every user of these devices needs to ask themselves, because we don't know what's in there. And already there have been several hundred chemicals that have been observed and measured in these liquids and in the aerosols that they generate.
Mhm. Thank you. The next comment and question is from Kathy Castro. TCAT has worked with the hospitals and clinics in the past to inquire upon admission to their facility if an individual vapes and not only if they smoke. Do you know if they're continuing to ask this question and documenting it at this time so data on COVID patients can be recorded?
That's another excellent question from an excellent advocate. So I'm really happy to welcome Kathy to this webinar. And Kathy has been so pivotal to some of our tobacco control policies here in Ireland. I think, Kathy, I don't know what's going on right now at the hospital, but certainly they should be asking this question. I think every clinic, every healthcare worker that has a clinical encounter with anyone suspected of having COVID-19 or coming in for COVID-19 testing should be asking this question and documenting it.
Mhm. We agree. Another question, can you share about cessation assistance currently available during COVID, especially for youth that you mentioned earlier have higher cases of usage?
Absolutely. Another excellent question. And I think very importantly, our community needs to know that there is a 24/7 quit line that is funded out of the Department of Public Health and Social Services, which can be accessed either through a phone call at 1-800-QUIT-NOW or through a website, Quit Now Guam, and this will link you to a certified cessation counselor. And for those who are using nicotine-based products, they will evaluate and determine if you need help with a nicotine patch or nicotine gum. And if you qualify, you will be able to get these products for free. These are paid for out of a grant from the Department of Public Health. So this is a very important resource. And I also know that at the Guam Behavioral Health and Wellness Center, they have a helpline that you can also access to ask about cessation counselors on island. So we do have resources that are in existence right now for our community.
Thank you for mentioning those. We have a question that came in from the chat box from ACS Can Hawaii AU. Does menthol play a big factor in use of vaping?
Wow, that's another excellent question. You know how menthol was really used by the tobacco industry to hook a lot of younger users and also a lot of people of color to use cigarettes. So I don't know, Sarah, if you knew that, but menthol was a big draw for, like, for example, the African American population in the U.S. to get them started on smoking. And I have to say that they have outdone themselves when it comes to vaping, because not only do they have menthol, they have over 15,000 flavors for these vape liquids. It is just amazing. If you look at the products, they look like candy or fruit or bubble gum or like an espresso coffee vape liquid. The numbers of flavors are astounding, and naturally these flavors and the beautiful aromas that they generate, they're very attractive to young people. And so these are the things that get them to notice the products. And then the nicotine that's hidden in the e-liquid is what keeps them addicted. So definitely flavors have a major role to play in the vaping epidemic. And I will call it an epidemic, especially among youth. And one of the interventions that's being proposed globally is to ban flavors in all of these liquids.
Mhm.
So we'll see how that works. But definitely flavors are a main selling point for these devices.
It sounds like history repeating itself, right? With the
Absolutely.
tobacco
Yes, yes.
industry.
It's the same playbook. This is the tobacco industry. I keep saying the vaping industry is really the tobacco industry in a bit of disguise. So we shouldn't be fooled.
We have one more question. Actually, we have another question asking for a copy of this presentation. We will be making it available on demand. So a link should be posted on www.peaceclub.org, or if you follow at GBHWC on Facebook, we will also post it there. If you're looking for a PDF copy, please email staff@peaceguam.org so we can provide a PDF copy of the presentation later. The question from another anonymous attendee is, which gender uses vapor more?
Yeah, an interesting question. If you look at the youth, there's no gender difference, which I think is a fascinating finding. So boys are and girls are as likely to use it as each other. So there doesn't seem to be a gender gap, particularly among youth when it comes to the use of these devices.
Mhm.
And again, I should emphasize the use among youth is so much higher than among adults. I actually think it's shocking that 1/4 of middle school kids are using these devices.
Mhm. There's another question that came in. Are there any regulations on the e-liquids sold on island?
What we have right now is a law, and we are ahead of many of the states. We have a law that considers e-liquids and vapes as tobacco products, so you can't sell them to anyone under the age of 21. And if you're under the age of 21, you can't possess or use them. But we still need to do a lot more. And certainly things like, for instance, banning the flavorings, that would be really good. We need to increase the taxes on these products, just like what we did with tobacco. When we did the tobacco taxes, we saw a very quick and significant drop in their use. So taxes on these products are actually a win-win. And I think maybe what we can do is maybe tax these products and maybe earmark a portion of the tax revenues for pandemic preparedness or for economic relief during the pandemic, right? I mean, we can certainly design fiscal interventions to truly benefit the community.
Mhm.
So yeah.
Mhm.
And
It's
also no
actually
vaping in places where smoking is not allowed. So that's something that's good that we have here.
right. It's actually a good segue to the next question. They were asking, or the person was asking, if it was realistic for Guam to pass a law and enforce a ban on the importation and sales of flavored vape juice. It seems like it's been done before outside of
Oh,
Guam.
okay. That's another really that's a very thoughtful question. And I like to the way I would like to approach that is to say that interventions can work on one of two sides, right, of the equation. They can work on reducing the supply, which this is what that would be. Ban the importation and sale, so you limit supply, and the others work on demand, reducing demand. And what we've seen throughout history, whether it was with like the prohibition with alcohol or with drugs and the drug trade, is that if we only work on reducing supply without doing anything to bring down demand, people will find ways to get it. So for me, it's more important to address demand reduction measures first and then work on the supply side measures. And that I think is the more rational approach to it. But that's an excellent question.
There's more than one way to go about this epidemic.
Absolutely. Yes.
The next question is, are youth using to cope with other issues like stress, to deal with problems, or their underlying social issues?
Yeah,
Or
that's
are
another good
there underlying social issues?
That's another really good question, Sarah. We get our data from survey information, and in some ways it's very good because it's quantifiable, but in some ways it's very limited because these sorts of questions, the why, why are people vaping, why are young people using, they don't come out through those methodologies of collecting data. So I guess to be able to answer this, we need to do what we would call qualitative research versus quantitative research, meaning we have to do more of interviews and focus groups and really speaking to young people who use these devices to learn what they think and what they feel and what motivates them. And so that's a step that we still need to do for the island. We can do a few things like look at correlations in the data that we have. And what we found is that vaping tends to cluster with other behaviors. So youth who tend to use alcohol and to smoke cigarettes and use marijuana are also more likely to use or to report the use of electronic cigarettes. And there also appears to be some correlation with depression and poor performance in school. So these are some correlations that can come out of the data. But to really understand cause and effect, we would have to do the more the more detailed qualitative approaches like focus groups.
Mhm. I believe we have some friends from the National Guard in our audience, and they're asking
Yes, shout
for
out to
some
them. Yeah,
some
great partners with
documented
us.
age. Right.
Yeah.
So they're asking for the youngest documented age. I'm assuming this is for vape use that's been recorded. They will be using it for a Red Ribbon education outreach next week to inform the youth.
Okay. Well, we get aggregate data, so we don't get data on individuals. So we don't really, I mean, I can't give you like the youngest age ever on Guam, but I can tell you that in middle school, they are reporting that. And middle school, can be as young as what, 9, Sarah? Is that right?
Mm-hmm.
9 years? Yeah,
Mm-hmm.
8, 9 years. So that's what we're
It is.
seeing.
Right. Thank you for addressing that. We have two attendees that's asking about what is found in vape as an ingredient. Do you categorize chewing tobacco just as harmful as vaping? And then the second
Well,
is,
they're they're all in that spectrum, so they're not equivalent. I mean, they're not exactly the same, but there are overlaps. So chewing tobacco is also a health risk. uh, we know that mouth cancers, for example, are higher in people who chew tobacco. So it's got its own set of risks, and it needs to be considered as part of that spectrum of tobacco use.
mhm. We
And,
have
and
Mr.
then,
Joy Mand. Oh,
I'm
go ahead.
sorry, go ahead.
Sorry, didn't
Go
mean
ahead.
to cut
No,
you
no,
off.
go ahead.
Oh, I was going to say, Mr. Joy Manipusan is asking, have there been illegal or controlled
Wonderful
substances
question.
found in vape ingredients?
Yeah, you get the medal for this, Joey. Yes, yes. In fact, I always say that we need to look at the vape pens or the e-cigarettes not just as an alternative tobacco product, but really as a drug delivery device. Because realistically, if you can get anything in liquid form, you can use it in these devices. So in fact, there are young people who use the vape pens with, for example, liquid forms of marijuana, and they call this dabbing. Not the dabbing that is a pose for photos, but dabbing being the use of liquid forms of marijuana in vape pens. And I think very interesting for Guam, uh, we know from reports from our friends in customs um, and the law enforcement agencies that there have in fact been shipments that have been seized of amphetamines, but not in its usual rock crystal form, but in liquid form. And so you have to ask yourself, why would anyone risk shipping drugs in liquid form? Liquids are easy to get destroyed during the shipping process. They can spill, they can break. So why would they want to ship drugs in here in liquid form? And I think, although we don't have the data to back it up yet, but I think it's very likely that people are using the liquid forms of these illegal substances in the vape pen. So I actually think these devices are sort of like a Pandora's box. If you have them, they open the door to a lot of illegal activity, and and I think that this is an issue that our policymakers need to consider, because really there's not a lot of good that can come from these devices, and a lot of potential harm for our society for sure.
Mhm. Thank you for sharing that. We have Mr. Ed Taitano, who said, "Hi, Dr. David, excellent presentation. Are there resources like CDs or video clips that we can get or that you can recommend that we can show regularly to the youth to continue educating the youth about the harm of vape use?"
Absolutely. Hi, Ed. How are you doing? We certainly miss you at the prevention and training branch, but there are a lot of materials that you can get from, for instance, the campaign for tobacco free kids. You can get them from Vital Strategies. There are several from the US CDC and from the World Health Organization websites. And these are all freely shared and can be disseminated and used for educational purposes.
Thank you for sharing that. And I believe the Department of Public Health also has a health education team led by Ms. Liz Guerrero, and they've been in contact with teachers and administrators at DOE to share those resources as well. Um, we have an anonymous attendee asking, do we have statistics from DOE on students using or who have been caught with vape devices and vape juices?
Yeah, we do have this data from the DOE. I can tell you that at one point it was so prevalent that the DOE, they were concerned about storing all of the devices that were confiscated from the students, because they were worried about the fire risk and the explosions. And also on occasion, students would try to break into the principal's office to get their devices back. So it is a significant problem. I don't have the numbers off the top of my head, but I know that they do keep track of this.
Mhm.
It is, I have to say, it is a major problem in schools.
Definitely. And speaking of like keeping track of what the data looks like, anonymous attendees asking, is there a cohort being established for long-term study of the effects of vaping on island?
Not that I'm aware of. It certainly is a good idea. At this point in time, I don't think there's any sort of like a prospective cohort study that's being planned. But what we do keep track of as part of our health surveillance is the prevalence of the use of these devices in the Youth Risk Behavior Survey, which is administered by the Guam Department of Education. So this is a good idea, and if people are out there looking for research projects, this would be a good one to take
Mhm.
on for sure. Yeah.
Right. We are nearing the 30-minute mark for our question and answer. I'll take one last question. From Mr. Jean-Marie Montano. Great presentation. I love how visual and detailed your information about vaping in COVID-19. Is vaping an illicit drug and is it illegal to use?
No, it's not. It is a commercial product that can be bought and sold on the open market, and in part that is an issue because it's easy for folks to have access to it. I think I'll link that to another question I see. If people mix their own e-liquids, is it less harmful than store-bought? And I would have to say there's no way of knowing because we don't know what's in those e-liquids. That's a big part of the problem. These are not regulated by the FDA because they're commercial. They're not medical grade. They're not pharmacologic. And so any maker can put whatever they want in these liquids and sell them, and you have no way of knowing what's in them. So a good example, for instance, is a popcorn lung, which came from a substance known as diacetyl, which was found in some e-liquids. This is a flavoring that used to be in popcorn. This is a chemical that gives that butter flavor to popcorn. But apparently they were using it in the e-liquid, but apparently if you smoke it, if you inhale it rather than ingest it, it causes severe damage. And what was happening was people were coming up with really bad scarring of the lungs, and to the point where they would need pulmonary transplants. And so there are case reports of popcorn lung, which has been found to be caused by diacetyl that was found in an e-liquid. But because these are not regulated products, they could have put it in there, and you only find out after the fact, after some group of people develop a really severe pulmonary disease.
Mhm. Thank you for addressing that. And I wish that we can spend all day. I don't know if you feel the same way, but I wish that we can spend all day talking about this topic. There's so many more questions that are asked on the Q&A box about possible legislation and what's more harmful. So because that's all the time we have to all the attendees, we invite you to forward those questions to our email. Again, it's staff, that's STAFF @peaceguam.org, so that we can forward your comments to Dr. David or find a response to the questions that we didn't get to address in our webinar today. Again, thank you, Dr. David. Thank you for sharing your time and your expertise. I'm going to pass it on now to Audrey to close our episode.
Thank you, Sarah. And thank you once again, Dr. David. And to all our attendees, we appreciate you spending your lunch hour with us at Peace. You can share with us your feedback on today's episode in the evaluation survey that will follow once you end this Zoom session on your device. Have a great rest of your afternoon, and we hope you'll join us again next month, November 18th, and we will be talking about social media and well-being. And just a side note, our office is also currently offering a free online training on suicide prevention. It's called Living Work Start. So if you are interested, please feel free to contact staff at peaceguam.org. Thank you so much and have a good day.